Abdullah, Chairperson of the Medical Imaging Department, King's College Hospital, London, Jeddah. Round of applause as we are joined by a spectacular moderator here on stage. Please do put your hands together as I have a very, very warm and hospitable welcome to our esteemed panelists. Will be joining us here on stage, Associate Professor Vice Chairman of Medical Board Education at National University Hospital, Singapore. I'll also be welcoming Ms. Liu, MD, Vice President, Global Advisory, Master and Moringham Associate Radiology, Division of Intervention Radiology, and Assistant Professor of Radiology at Harvard Medical School. We have the pleasure of having Dr. Muhammad Fahim Muhammad, MD, CIP, Section Head, Imaging, KFSHRC, Secretary of the Board of Radiological Society of Saudi Arabia, amongst us. It's a delight to extend a very warm welcome to Ms. Margaret Legends, Vice President, Head of Product Management, Marketing and Design Philips. Let's hear a warm round of applause for all our speakers.
Everyone. My name is Nouf, Abdullah. I'm a radiologist by specialty and a women's imager and breast imager by subspecialization. Welcome to our last session in the day. I know it's very hard to attend the last part, and we have a great panel of members that will talk about AI and future direction in radiology. So let me just give me a few minutes just to give an introduction about great members of the panel. We have Dr. Alfred Poe. He's the head and the senior consultant of the Division of Hepatobiliary Surgery. He is subspecialized in transplant and hepatic and biliary surgeries. He believes strongly in medical education and mentorship. He received many awards in education and training and teamwork, and he has many publications. And he was cited as one of the top 2% by Stanford University in research. Our second member is Professor Leo. He's the Vice President of Mass General Global Advisory. He served as an associate chair of business strategy and analytics, and he had a prior role as a director of the consulting service. Dr. Leo graduated from Harvard Medical School. He's specialized and has dual residency in pediatrics and radiology, and he has subspecialty in interventional radiology, and he has many publications regarding strategy and screening workflow. The speaker is Dr. Muhammad Fahim, great radiologist that I had the chance to work with. Dr. Fahim is an abdominal and emergency radiologist. He works in King Faisal Specialty Hospital in Riyadh, and he is the section head of abdominal radiology. He has many research, and he holds the position of the Secretary of the Board of RSSA, Radiology Society of Saudi Arabia. He's an excellent, amazing radiology educator and researcher with many focus on improving cancer diagnosis. Our last but not least panel, Ms. Margaret. She's a global product management executive with over 15 years of experience driving growth with patient-centric innovation. She had led the introduction of award-winning helium-free MRI, which is a great introduction to our field. Welcome our members, and let's start the discussion. So we're going to talk today about exploring the future in radiology, and I would like to start with Professor Leo. I have the first question. How can AI streamline radiology workflow, and what specific tasks can it automate and augment our daily practice of an academic radiologist? How can we do that?
Thank you. First of all, thank you for the honor of being here. This is Distinguished guests. I think it's really interesting, your question about sort of how artificial intelligence will actually engage in our workflow. You think about how quickly the field is evolving. ChatGPT just came out 2 years ago and was the first to hit 100 million users, I think in 2 months, right? I think Netflix took 2 years, TikTok took 9 months, and it's just really incredible how fast the technology is. I would say that AI, generative AI in particular, has 2 pathways that can really help things. It can help both the radiologists within the workflow of the actual radiologist, but also it helps sort of right around surrounding the radiologist in terms of the operational workflow. And some examples I'll give you. Outside the workflow, before the radiologist even sees an exam, you can imagine that generative AI and artificial intelligence helps an incredible amount of decision support, right? So if the referral provider doesn't know what type of MRI or what type of CT order, there's a lot of wasted exams without that. And generative AI has just this incredible ability to take reports from the electronic medical record and then support sort of what the right decision is. After the radiologist even makes a report and it sees the image and makes the diagnosis, you can think of generative AI and artificial intelligence really helping with the patient understanding, right? So there's a diagnostic report, the patient really struggles to understand, you need a summary that's in layperson's words. It's incredible that generative AI can be used for that. So even though there's lots of hype about AI for the actual radiologist, which we can go on forever, it's really the whole workflow that I think is most interesting.
That's great. I'm sure that has affected significantly the workflow of the department, increased the numbers, and probably has reduced the cost the cost has reduced significantly in the radiology department.
Just not like cost, it's also how physicians and how the healthcare system feels about the workflow. It's around burnout, right? And so the less that radiologists have to be dealing with sort of incorrect exams, the less that they have to call their referring provider and not sure have that conversation that this can be automated, the better that the radiologist gets about sort of doing his daily work and spending time with the referring physician in meaningful conversation rather than a conversation that really is busy work focus.
So it's encouraged and really supported patient-centered care and improved the patient-centered care.
Completely agree.
Thank you so much. Our next question is Professor Paul. So from your perspective as a surgeon who does a very complex procedures, and some of them are micro-invasive and with significant interaction with AI, can you tell me how AR and VR affected your practice and how did it improve it or take it to another direction?
Thanks for the kind introduction. I think it's important for us to visualize how the future state of navigation surgery is like. Because on a day-to-day basis, we have radiologists who scan, they are in 2D form. But nowadays, there's a lot of software where we can convert the 2D scans to 3D models. And it's particularly important for my field, for example, in better delivery surgery, because the liver is a very complex organ. There's vein, heart, and so on and so forth. And more importantly, for example, the relationship with the tumors, with the blood vessels, and determine how we transact the model, for example. And having the ability to reconstruct many of these, and nowadays actually the volume population can even be identified by artificial intelligence algorithm, given how it can receive predict how much of the liver will be left behind, what is going to be resected, and more importantly now with the AR technology, mixed reality technology, for example, in the hospital, with a big program called All Medicine Program, where we use hologram and reconstructed from 3D model, superimposed in on the automated field, such that you know exactly where to cut and where it's close to or not close to the blood vessels. And that gives you precise steps of the operation in a safe manner and ensure a positive outcome. So as far as I'm concerned, I think this is where the groundbreaking change is going to be, where the streamlined work of radiology to surgery is going to really change the way how we do our surgery, because now it's not going to be just reconstructing this in the brain of an experienced surgeon. You can actually see the young surgeon can actually see is to learn much faster what is in the mind of an experienced surgeon. And in the future, in fact, our hospital is building what we call digital twins, where we can get all sorts of information that is now out on the cloud. For example, on table, if you put an ultrasound and ultrasound match to a pre-operative reconstructed CT scans, and it can do immediate change in information. That's where we think AI in the future, facilitated by all these technologies, will be able to allow us to do very precise surgery.
Nice, thank you. I have another question in mind. Have you used the AR and the AR and trying to explain to the patients and make them in the center of what you're going to do during the surgeries? What do we expect after their life? Did it affect the patient-centered approach? Did you use that?
In fact, you asked a very interesting question, and we did that because the actual scan of the patient can be uploaded and the patient can see it very immediately. If two persons wear the same head-mounted device and enter what we call the healthcare metaverse, they can actually see the scan and they can understand actually when you're planning a surgery where the in fact, we do that for all our line donors. They actually understand the operation and reduce their anxiety, increase the confidence that the patient actually understands what you're going to do. It does provide a lot of rapport within the patients, increase their confidence, and overall, I think patients really enjoy the experience of walking through the journey with you in such a different manner.
Did you use any analytics or data that came out of the AI to predict the outcome of new surgery based on what came out of the AI and the VR?
We're currently doing a study on that now, comparing conventionally or not having that versus using this technology, how it will change the way how we do the surgery. And I guess the result will come out and publish that. What we have concluded very interestingly is that at least for the trainees, their level of confidence and ability for them to overcome the learning curve seem to be a bit better compared to the traditional way of training.
Looking forward to see the results of the research.
Thank you.
Thank you so much. Next question is about the accessibility and the quality of care, and knowing that you are great educated, the training, education, patient-centered care, satisfaction, burnout. How can we use AI to improve all of that and have a good impact?
Thank you very much. So I'd like to that's a big question, so I kind of want to categorize it into academia, achievement, which combines with job satisfaction, burnout, accessibility, and awareness. So for academia, let's start. Large language models and generative AI has a huge potential to produce a very productive, robust educational environment for radiology. Right now, one of the benefits of an academic radiologist is that your trainees come in, they predict your reports, they annotate, they find these things, and if you have a good trainee, you're going to have very good. You're going to get through 20, 30 MRIs. If you have a bad trainee, that's going to slow down significantly. Now, with something like LLMs and even ChatGPT or other solutions like that, there's a potential of that acting as a support in that first step, where it comes in, annotates the images, segments the organs, does the boring tasks, volumetry, comparison of influence, etc. And if all that is pre-done, when you sit down with your trainee, you're giving them the essence of your knowledge. You're not bugging them about, hey, rewrite this phrase this way, or change this millimeter to centimeter because I'm very particular that way, and I want centimeters in my report, etc. So there's a huge potential there for improvement. The problem and drawback here is that if we look at LLMs and generative AI, I don't know if you all heard of Strawberry Date with ChatGPT or any of these large language models, where you ask this model how many R's are in Strawberry. And every time it would give you a wrong answer. It cannot count R's in Strawberry. It'll say 2, 4, it'll say 1. And that's a problem with how these models look at your question or look at the input. And it's not looking at it as we look at understand it as a word. It's looking at it as a pre-programmed token, that this is 2 tokens, one is strong, one is varied, and it's averaging out the rest. So if you imagine that in practice, sometimes we might have an issue where the way things were tokenized and the way things were trained, you might have these little inconsistencies. So if our trainees are not aware of that and rely heavily on these outputs, there's a potential for error propagating down the system. The other thing is, a lot of our trainees these days are from the, iPad generation or Google generation, where nobody reads testers, right? Everybody Googles information, and it's very good. I don't think a trainee should know what is the normal range of, right? Like, what's the normal size of a screen in the screen? You can Google, right? You don't need, it's not a good exact question, for example. And they can Google it, and they have the skills to vet the information and make sure it's a correct source, a reliable source, and correct information. The problem is when you ask an LLM or a generative AI, they'll give you an answer that looks very professional, looks very convincing, and you might take it at face value, and you might not challenge it. So I think there's a bit of a drawback here, a bit of a concern. So making sure people who interact with these technologies are aware of these drawbacks and creating education on how to spot these kind of issues and how to overcome them. And when things are made specifically for healthcare, we address it in a better way, is probably the way forward. So it's a double-edged sword as it is now, but there's a very, very bright potential there. I won't take too long. Let's talk about just achievement and burnout. So in this wonderful, kind of future where you have this augmented AI assistant that's listening in, and you tell it, hey, this guy, what's his last liver, for example, and did he have any surgeries? And it goes through it and gives you that information. And right now it's being sold that that's going to increase your productivity, that's going to relieve burnout, and that's going to give you more time with the patient so you can sit down with the patient. However, we've seen with advancements in like PACS or even, in CAD and pre-screening, that sometimes those productivity savers or the time saved translates into more work. So if we want to really address burnout, if we really want to push radiologists back into being a doctor's doctor and having a role for patient interaction, we have to kind of find that balance. We improve productivity. If we can improve it by 100%, we should maybe look at 60%. So that time can be spent for work, more tasks that bring joy, that bring satisfaction, that make you feel that you are contributing to somebody's life.
I 100% agree with you. I think having all of these AR, AI technology and advancement, it gives us a lot of time to interact with our patients, interact with our residents and training. Because as I think most of us really believe that training and mentorship is a crucial part for education of the next generation. All of these AI, at some point we might lose the human interaction with each other, and that's something we don't want to live. All our patients, they need us, they need our attention. So this is a very important message for everyone to understand. Thank you so much. Ms. Margaret, how is AR, AI, and VR advancing the concept of personalized medicine? I love this area. Personalized medicine is an area that's very close to my heart, especially in radiology. And how can we integrate all of these parts that can help sustainability in radiology practice?
Yeah, indeed, personalized medicine. I think it's going to be a big development in the future. And we talk about the future, right? Also today, we've seen about the future is built, building new smart hospitals. And I think maybe far ahead, the future might not be in the hospital, but in the home. Because if you think about personalized medicine, it's all about moving from curing to prevention. So that requires more precise and predictive imaging, for example. AI is inevitable, because AI is an enabler to run faster exams, to optimize workflows, to improve productivity, to deal with the huge pieces of audience that we see. But personalized treatments, personalized pathways will no longer patients that become more and more demanding. So the combination of their individual characteristics, genetics, but also lifestyle elements is a lot of data, and I believe that integrating those insights is a huge potential we have now. I was actually surprised, or maybe it was good to see, for example, companies like Technology also being here at the conference. And why are they here? Because the personal data that's being gathered while I'm working out, what am I eating, how's my heart rate developing, is such a valuable data that we combine that with data once somebody ends up in a hospital for an MRI scan. That combination will really lead to personalized pathways and more important, better outcomes. So we talked about time lock, and you see that AI is now implemented to digest the big workflow. But do we want to log another 10 patients on a day? Or do we actually want to use that time to give better care and prepare ourselves for the future where a lot of care will be out of home? So remote diagnostics, remote support, remote clinical support, I think is really going to be a fundamental part of the future. Now, where does AI also come in? At the moment, we're able to project this future of smart hospital and smart home being well enough. That future will be green. It has to be green. Because if we look at the healthcare industry impact on CO2 emissions, it's 4%. And that is more than any other industry in the world. More than airplanes, more than transport industry. So there will not be a future if we do not act now. And where does AI help? At the moment, we're able to run more sustainable systems. AI can already predict the usage, the energy consumption. But AI is also really needed to look those different workflows in the hospital to see where is actually the biggest waste, where do we use a lot of energy, but also where do we consume a lot of unnecessary plastics. So AI will unlock, and it's the insights that AI will give us, that will actually drive us to improvements.
Well said. Really well said. Thank you so much, Ms. Reinhardt. Thank you all for a great discussion. I would like just to close our last session with the last question. I think everyone, all radiologists and people in the radiology field would ask, what do you think? What's your final thought about human AI collaboration and about AI replacing radiologists? And the floor is open for you.
I'll start with the phrase that we use at MPH, I'm sure many others have used. Radiologists for the last few years have been scared for their jobs, right? I mean, that's sort of something that you go to first today, big conferences. But in the last 3 or 4 years, I think the right phrase is, artificial intelligence won't replace radiologists, but artificial intelligence will replace radiologists who don't use AI, right? And so that's a common phrase that we use a lot, where AI has to supplement and sort of everything that we're talking about. I think the previous conversation talked about civil, right, as a for lung nodules, breast cancer as well too. It's AI is definitely going to be a tool, but hard to imagine that it will completely replace the radiologist.
I'd love to hear Professor Koh's perspective as a surgeon who deals with people like me all the time.
Well, as a surgeon, I certainly don't want to see my radiologist colleague disappearing from the field. And I really think it will not be, because I think the human brain is more powerful than the artificial intelligence. But the quote that I like most is that you should not fear AI, but you should make AI work for you. So you want to create a future and make it work for you so that it works in the best way, and it will not replace you, but make your job in a more excellent and better manner.
I agree 100%. Mohammed, please.
Yeah, no, I agree with everything you said. I just wanted to add to that I really don't think there's any role of replacing anybody with any kind of technology completely. Right? So if there's any kind of job displacement in any industry, there's usually a new job creation that the companies do. But specifically with AI and radiology, radiology, where most AI healthcare research has been focused on. We see that a lot of research is focused on the low-hanging fruit, but that's competing directly with daily work of radiologists. And there's an issue of, is it producing a good enough result that you can forego? But now I think a lot of the industry is waking up to, okay, how can we augment radiologists' workflows? And that's even more prosperous because radiologists are big spenders, right? We spend a lot towards the industry, and so if you keep us happy, we will give you money as a private industry. So increasing our efficiency, making us better, increasing our productivity will only help everybody, including our patients, and especially our patients. The other thing is that there might be some changes in roles, some changes in classical and subspecialties in radiology. Maybe we don't need classical subspecialties going forward. Maybe Eric Football, who's a very famous researcher, physician, and a very common person in healthcare AI, he envisioned that there might be some kind of change in the way diagnostics are practiced, where there might be some kind of merger between pathology and radiology in the future. I can see that happening. If we might end up training diagnosticians who look at images, look at slides, and provide that report. That may be a little bit down the line, but things will change, they will evolve, and we'll always find room for that. And it's important that we stay at the forefront of this revolution.
Thank you so much. It was a great discussion. I really thank each one of you, and I really enjoyed the discussion with you, and I would open the floor for any questions.
Hello, thank you very much. It's really an honor to see such a reputable panel here. I represent a company called Blue Mind. We've developed the advanced artificial intelligence technology for medical images interpretation. And I'd like to ask you one question. It's about incorporating technologies into clinics, hospitals, and corporations. Do you think that the market is ready for that, or it's more about talking, strategic vision? Because there have been a number of researchers proving that AI technologies are precise, they save time, and they make radiologists do less mistakes and so on the one hand. On the other hand, we as a startup are really struggling to get into big hospitals because it's a new technology, and I think that many people here are still conservative. So what do you think, how fast is it going to evolve? How long will it take for hospitals and clinics to really incorporate these technologies? Because I'll tell you just one more thing, that there are some countries where some diagnoses are 100% backed by AI. So it's different for all countries. What's your vision of in general and of green market?
It was a lot of elements in your question, but if I capture correctly, your question is how quickly will this technology transformation occur? And I think change happens when there's friction. You see the COVID times, right? Then we accelerate friction, but then we take a big jump. So when we talk about personalized medicine, personalized treatments, that will force everybody to change because the demands will go even further, and we cannot handle it anymore. So that will move more forward out of the hospital. And I believe we are close to that disruption for that nowhere around the world will be sustainable to manage. Now, if we think about this, is also a topic of the forum here, collaboration, right? So you mentioned you're a small company trying to get access in the hospitals. Then we also need to look at how the Googles, Amazon, not the apples of this world work, right? So open forums, I think, where access is easy for everybody are going to be essential, right? So we may have specialist solutions, but the hospital might not deal with 20 interfaces. And I think at the moment, the system will start showing breaks, which is signs. That is where partnerships, collaborations will force the change. And I think it will go really fast.
I guess I'll here's a quick analysis as well too. I agree that it goes fast and slow, what you're saying. I will say that it may not necessarily depend on the technology, but it may depend on sort of, I think what you're asking is the culture around the technology. And so a good example is that, these are many people's complaints here today. My understanding of the airline industry is that the plane can probably take off and land itself, right? But you still have pilots there, and there's a matter of trust, essentially. So until that trust, comes with the intelligence and the technology, and you'll always have to look at that barrier. I will say though, as long as the technology keeps on improving value, specifically to the radiologists, then that will increase the adoption. A great example I'll use is, we think about AI as a triage mechanism at MGH, right? And so you have a long list of exams to look at. You want to be able to not just do first in, first out. You want to look at the brain CT that has the hemorrhage. And so if you can triage that at the top, that's the sort of AI technology that, saves a ton of time and has a lot of value for the radiologist. And that would be the day today.
Yeah, so exactly, just like following up on what you said, I exactly agree with Greg. It doesn't matter also what value is added to clinical practice, right? I think just if you go to any stroke center today, almost all of them, advanced stroke centers, have some form of AI that does the pre-processing for stroke, CT perfusion stroke, and has some kind of assisted or augmented reading workflows in those areas. And just 5 years ago, almost nobody used them. And there are multiple solutions because they show value. They save time, increase door-to-needle time for stroke patients, and there was value. It wasn't that you read it better than a radiologist, or I don't need a radiologist and a neurologist, right? It's none of those issues. It's that there's a clear value. So even if you have a tool that does something well, but it's not adding value to the hospital, to the center, it's going to be a hard sell. If it's an efficiency gain of 1 or 2%, it's a hard sell. That's one thing. The second thing is, you mentioned that some countries have AI-only rates for some things, right? So that's, again, coming back to the issue of what was 10 years ago, AI versus human. Jeffrey Hinton coming out and saying, stop training radiologists. Radiologists are obsolete. We don't need radiologists anymore. And today, we're training more radiologists than ever. The match is very competitive for both IR and DR radiologists. So this kind of phrasing, or this kind of communication is very troublesome. And the issue that arises in these cases is ultimately who takes responsibility for errors, right? Because with AI, you have bias. If you're not using the AI on the exact population that you trained it on, you're using it in another country or another group of people, you're going to have biases, you're going to have errors, you're going to have drift over time. Who's responsible if something goes wrong? Who's responsible if on that chest x-ray that you pre-read with an AI for tuberculosis, which I know some countries do, there was a big lung nodule that wasn't picked up because it wasn't perceived as TB. So there is an ultimate issue of accountability, I think, involved with this kind of AI first or AI only reading. So I don't think that's ever going to be in place, at least in countries where there are the resources to have a multidisciplinary team and a good number of physicians that handle patient care first. So to kind of break into those markets, you have to identify what are the needs of that market and how can you help them improve their mission.
I would just like to close and answer for that question. We always, whenever
whenever we adopt a new technology, I always think about three areas. It should improve patient outcome, it should be simple to use for me and for my staff, and then the ROI, return on investment, it shouldn't be very expensive. So anything that we adopt should match these three criteria, and then definitely we open the floor for it. Thank you so much for the discussion, and I really enjoyed it, and thank you so much for attending, and have a good evening, and enjoy our beloved kingdom and reality.
Thank you so very much for our wonderful moderator and our panelists. I think we could have asked for some spectacular speakers and what a fabulous session. My delegates, may I once again request you all to please put your hands together for our experts, as I request you all to join us in a group photograph as we capture this moment, please. And please allow my wonderful speakers to join us for a group picture, and also taking a moment and thanking